and I'm going to be today's host as moderator. So, hello everyone, and welcome to our first ever virtual baby shower series. We are all excited for this week, filled with important information about pregnancy and postpartum care, breastfeeding, and more. Today, Thundermist prenatal care providers are here to discuss COVID-19 and pregnancy. Our very own Dr. Jennifer Buckley and Dr. Jessica Johnson are here today to help answer your questions, offer relief on what to expect when you give birth in the hospital during COVID-19. This is a live event. Please type your questions into the comments during the live stream and we'll do our best to answer them. We have an amazing group of organizations who sponsored this baby shower. Neighborhood Health Plan of Rhode Island, United Healthcare Community Plan of Rhode Island, Tufts Health Plan, and Landmark Medical Center. Thank you all for your generous sponsoring and virtual series. We are excited to have our own baby shower sponsor with us today. Her name is Wendy from Tufts Plan of Rhode Island, is here to further explain how you can enter to win the grand prize. Wendy?
Good morning, everybody, and welcome to the first virtual Thundermist baby shower. We're excited to announce some raffle prizes that we have and how to enter. So some of the prizes include crib, car seat, stroller, and an actual baby monitor. So for each session, we will have the link on the comment section so that you can click onto the link and submit your request for the prize, sorry. So everybody needs to be entered by July 26th, and then the winner will be announced by Monday, July 27th through Facebook. So also as a Thundermist sponsor, we also have a few perks through Tufts Health Plan that I would like to mention. So we are the only carrier for Medicaid that actually offers a doula program to our members. We also offer other perks to our members. We do gift cards for vaccinations, car seats, gift cards for car seats for new moms. We have a wellness program. We also have we work with an organization that also helps with wellness. They help you if you want to go on a diet, if you need help eating healthy foods. So if you guys have any questions, you guys can leave me a comment after. Thank you.
Thank you, Wendy. Now let's hear from our awesome providers, Dr. Buckley and Dr. Johnson.
Hi, I think I'll
Go ahead, Dr. Johnson.
I'll start just by introducing myself. So I'm Jessica Johnson. I'm one of the family physicians who also does prenatal care and deliveries in Woonsocket. And I mostly deliver patients at Landmark Medical Center.
And I'm Dr. Jennifer Buckley. I'm also a family doctor, and I do prenatal and deliveries as well at the Thundermist Health Center in West Warwick, and my delivering hospital is at Kent. All right, so we thought that we would start with some questions and just go through some things in regards to the coronavirus in pregnancy, or COVID-19, which is the other term that we call it. And so the first thing we wanted to talk a little bit about is, the big question we get a lot is, are our pregnant patients safe? Is pregnancy a safe thing to do right now? And I think at the end of the day, we are still learning a lot more about the coronavirus in pregnancy. And so we are encouraging all of our pregnant patients to take really great precautions when it comes to protecting yourself and your growing pregnancy, in the same way that someone else who might not be pregnant but might have diabetes or high blood pressure would be taking those same precautions in regards to really good hand washing and wearing a mask when you go out in public, and really trying to stay away from any public spaces that you don't really have to go to. Anything you wanted to add to that, Dr. Johnson?
No, I agree with you. I think that people are feeling some pressure to make life decisions. As we know right now, as long as you keep yourself as safe and following the recommendations that Dr. Buckley said, if that's, if you are pregnant or planning pregnancy, then that's something that we can work with you on, staying safe. So I have the next question, and I think this is one we hear a lot too, is, what are the expectations around guests and visitors when you're actually giving birth? I'll say that this can change from time to time, and this can change from hospital to hospital. So if you're getting close to delivering, it's great to get the most updated information from your provider and from the hospital where you will be delivering. As of right now, yes, patients in Rhode Island are able to bring people with them. There is no hospital that's delivering patients that expects anyone to have no visitors. I can say that currently at Landmark, people are allowed to have 2 visitors with them before, during, and after the birth process. And I do not see any changes to this in the future, but I don't know if you want to talk about the protocols.
Sure. Yeah. At Kent Hospital, and this also applies to women and infants because we're all under that same healthcare network called Care New England. Right now, every patient who's coming in labor can have 1 support person and 1 doula. And then that same support person can go with them to the postpartum area as well. Right now, we are not allowing any other visitors than that, although things, like Dr. Johnson was saying, things potentially might change in the future. And so that's how it's been working for us. And so the next question is, what can patients expect when arriving to the hospital? And I think some of it is just what we talked about in regards to planning who your support person is going to be. When you arrive at the hospital, all patients will get screened for coronavirus symptoms. And by screened, I mean part of the staff will ask you questions in regards to symptoms that you might have. And then you're going to get screened, and also your support person is going to get screened. This is going into the next question, but it just feels like we should just put it all together. All of our pregnant patients who are getting admitted to labor and delivery, whether it's a planned induction or a scheduled C-section, or you're coming in active labor, you'll get a coronavirus test. Your support person will not. They will just get the symptom check, but you will get the actual test. At Kent Hospital and Women and Infants, it's a rapid test, so it takes about 15 to 20 minutes to get your result. And I'll have Dr. Johnson speak to Landmark after we get through a couple of other pieces here. We are asking all of our patients to wear a mask. So you, as well as your support person, and all of the staff, you should expect to have masks on as well. During the delivery time, our staff will also have more gear on as well, knowing that this is a time where if someone did have the coronavirus, it could get shared a little bit more. And so don't be surprised if our staff has an N95 respirator on, and then a shield over their face, and a gown and gloves. And please don't feel scared or worried about that. That is what everyone's doing right now, just to really keep the protection going.
So I can speak a little bit to the Landmark experience, like Dr. Buckley mentioned. So at Landmark, also, all patients will be offered the rapid COVID testing with results coming back quickly. As with any test, it is not mandatory, but we strongly encourage you to do it because it helps us take the best care of you and your family and your baby, and helps us keep you all as safe as possible. All of your providers, all of the nurses, and all of the staff at the hospital taking care of you will also be masked. If depending on the results of that rapid test, determines kind of the level of gear we'll be wearing. So Dr. Buckley was talking about sometimes having a lot of that gear on, and that is certainly something we're doing in deliveries where it's warranted. And so, you'll have a pretty similar experience, I think, hospital to hospital.
Agreed. The next question is, what can pregnant patients and parents do to keep themselves and their baby healthy during the pandemic? The first thing that I would say is the ways that you keep yourself physically and mentally well outside of pregnancy or during pregnancy are going to be the same things that we're going to really want you to do right now in the setting of a pandemic as well. So lots of healthy eating, moving your body, drinking lots of water, getting adequate sleep, making sure you're getting some self-care time every day, going out and enjoying the sunshine when it's not 95 degrees outside, and doing all of those things that make you feel good. If we add the pandemic onto that, just thinking about your prevention strategies from coming into contact with that virus. So going back to really good hand washing, wearing a mask when you go out in public, avoiding those public spaces where it's really hard to socially distance, which is keeping 6 feet from other people, and only going out to public places if you really have to, would be the other way that you're gonna stay nice and safe. And then I guess lastly, coming to your prenatal visits, talk to your prenatal provider. Depending on what's going on during your pregnancy, your prenatal provider might be able to come up with a hybrid schedule that might potentially have you come into the office a little bit less, just thinking about infection prevention. But if there's other things that your prenatal provider is concerned about or wants to monitor more closely, your schedule might not change at all. So I think that conversation is best to have directly with your provider.
Yeah, I would agree with all of that as well. One question we're also getting frequently is about babies and about their vaccinations. Is it safer to come into the office to get those vaccines, or safer to defer them? Pretty widely at this point, the medical community is recommending that your infants are coming in for their regular checks for getting their shots. Just because we have the COVID outbreak doesn't mean that these other illnesses, these other diseases that babies are at risk for have gone away. And so the first year to 2 years of life is such a vulnerable time for our kids that we really want to keep them up on all of their vaccines and keep them as safe and healthy as possible. Most clinics, and I know Thundermist included, is doing everything we can to keep those babies safe when they do come in for the visit, putting them in rooms where they won't be exposed to any known COVID or anyone with symptoms. We are really prioritizing those well visits. It's also an opportunity for parents and for us to make sure that you have all the resources you need for taking care of your baby and other babies at home, particularly in those early months. And so, strong yes. Your kids should be kept up on their vaccines, particularly in the first years of life. That's really important.
Totally agree. So the next question is, what if a pregnant patient tests positive for COVID-19? I think this is a really good question, and I think this is a question that causes a lot of angst and anxiety amongst our patients, and rightfully so, because we're still learning a lot more, and this is the first season that we've ever had this particular virus with us. And so basically, if a pregnant patient tests positive for coronavirus at the time of delivery, what will happen is I'll just speak to my hospital. If you're at Kent Hospital, we will actually have you get transferred to women and infants, not because your pregnancy is going to be treated any differently or your delivery is going to be treated any differently, but it's more because women and infants has all of the special rooms to protect both you and the rest of the patients who are in the hospital from potentially getting coronavirus. So you would be transferred to women and infants, and then you'd have your baby there. and then your baby would still room in with you. And again, it's going to be a discussion. The pediatric team will come and talk to you about moms and babies and coronavirus and how to, really try to decrease the chance that the baby would get coronavirus. And so it's a really good discussion to have with your provider. But in general, there is some decent data out there that suggests babies can safely room in with moms if we take infection precautions that way. So you still will be cared for, you will get really wonderful care, and it'll be at Women and Infants.
Yeah, I can speak to that as well. So similarly in Woonsocket and at Landmark, you are at the hospital, and if you tested positive for COVID near your delivery, and we're able to safely transfer you to Women and Infants, we will also do that for the reasons that she mentioned. The resources are consolidated there in Providence. It is true that with us, and I'm sure at Kent as well, that if you come in an emergency, we are still going to take and so don't worry about that being a barrier to care. We're still here to take care of you. We have all the equipment we need, and then if and when we're able to safely bring you to Providence, that's what happens. I think the other part to this question is what happens if you test positive for COVID earlier in your pregnancy. And again, this really comes down to having that discussion with your provider about the timing that you test positive. But it is possible that if you test positive early in your pregnancy and we're able to show that you've cleared the virus and you have negative tests before you deliver, that you're still going to be able to deliver at the hospital. So if you are COVID positive for your delivery, there's one scenario. But if you test positive earlier, things may not look that different. And I think it's also important to know that we're still learning a lot about how pregnant people how they present with the coronavirus, who gets sick, who doesn't. Certainly anyone who gets COVID has a risk of being very ill and needing to go into the hospital. But that is not true for everyone. And we're still learning about if being pregnant impacts risk. And so anyone with diagnosis with coronavirus in touch with their provider if they feel like they have a positive and are getting sick. You may need to go into the hospital for care during that time. Not necessarily. You may be able to stay home for.
Totally agree with Dr. Johnson. If you are a patient of one of our Thundermists and you do have symptoms of coronavirus and you are pregnant, we can get you checked out and tested at one of our outdoor tent sites. So please know that we are here for you. We are here to help you sort all of that out. Please also know that just perspective says the most likely scenario if you actually get coronavirus is that you are going to end up being healthy after it's done, and your pregnancy is going to end up being healthy after it's done. So I think a lot of fear comes around, the possibility of getting it, and we want you to be super diligent. We don't want you to get that infection, but if you do get that infection, call your provider, and just know that the most likely scenario is that you will have a good outcome.
Absolutely. I have the next question, which is just asking, do you need to see your provider during the pandemic, and why is that important? And I think Dr. Buckley touched on this a little bit earlier, but again, pregnancy is such an important time that we have this kind of 9-month period where we're able to keep you and your baby as healthy as possible. And so the time seems to move quickly for some, and so keeping up with those regular visits helps us make sure that you have the best chance of a healthy pregnancy for you and your baby. Depending on your individual circumstances and your risks in pregnancy, those visits may happen by phone or they may happen in the office, but just being connected to your provider and to your healthcare team during a pregnancy can help us really answer questions and identify issues and treat you in the safest way possible.
I'm muted, sorry. The last question that we have here before we look at our live stream questions is, what should you do if someone close to you tests positive for COVID-19? This is a really great question, and I think the same answer that we would say for pregnancy applies for non-pregnant individuals. A lot of this information changes really quickly as well, and so the best way to get the answer to that question is to either call your provider, always a great first step. You can also go onto the Rhode Island Department of Health website as well. But basically, if you have someone who you've been in close contact with who has tested positive for the coronavirus, more than likely your provider is going to ask you to do one of two things, or maybe both. They might ask you to get tested, even if you're asymptomatic, or they might ask you to self-quarantine yourself for 14 days. And more than likely, they probably will ask you to do both. And that is because, again, we still are learning a lot about this virus, but we do have some information out there that says even if you don't have symptoms, you can still potentially be infectious to other people. So if you are exposed to someone with coronavirus, even if you don't end up developing a cough or a sore throat or a stuffy nose or a fever, nausea, vomiting, diarrhea, you could have still been infected. And so that's where that testing and the quarantining comes in. Definitely let your OB provider know, though. They are going to want to know if you potentially came into contact with someone with coronavirus, because they're going to want to talk to you a little bit more about pregnancy related things, and just make sure that you're staying in very close contact with each other.
I completely agree. I think it can become a little more challenging if the person that has been your contact is also someone you live with, a family member or partner. And so getting best guidance on really how to keep the food protected. Also keep in mind, as we were talking about earlier, everyone's allowed to have the support people that we mentioned with them in labor. But if your support person has tested positive or is undergoing testing to see if they're positive, they may not be able to join you. So it can be really nice in these times to have other friends, family members, or support people to step in and support you in case your planned support person is not going to be available.
Well, thank you. I'm back. Dr. Johnson and Dr. Buckley for that important information and keeping us up to date with everything. We're going to now view our viewers' questions. So we have Elaine DeSisto from Tri-County WIC office, and she's saying, thank you for doing this and providing all this good information. She had a question. Her first question was, what happens if the mom tests positive and is she still able to do skin to skin with the baby after birth? So whoever wants to take that question.
I can start.
Okay, thank you.
I think these are kind of those hard conversations that we need to have in the case someone's positive. I think right now we do everything we can to maintain that mom and child bonding. And so if someone is positive, the baby is allowed to room in with infection precautions. If it is mom and family plan to breastfeed, again, you can breastfeed with those infection precautions. And so similarly, I think, is skin to skin an option? And it's not something that the provider is going to tell you no, provided that the proper mask and gear you're wearing and you understand the risk of potentially transmitting the virus to your baby. And so ideally we're having those conversations before the delivery so we can make a plan that feels right for you and your family. So it's not a hard no, but that contact can increase the risk of spreading COVID to your baby, and we want to make sure that you have all the information you need to make that decision for your family.
Thank you, Dr. Johnson. So we have another question from Elaine. She said, and I'll have Dr. Buckley answer this one. Have there been any cases of infants getting COVID-19?
That's a really good question. Specific to the state of Rhode Island, I have not heard of any cases of newborns getting COVID-19 yet. I think in other states, there's been case reports. There was a study that was released from Wuhan, China, about I think it was around 30 infants who tested positive for coronavirus after delivery. So we know that there is a possibility. We are still trying to understand from a science perspective how it happens and when it happens, and what the settings are. And so we still don't know that information in full disclosure. But as far as I'm aware, and Dr. Johnson, I don't know if you have other information, but I'm not aware of any infants in Rhode Island testing positive yet.
Thank you, Dr. Buckley. We have another question from Amanda Bonney. Have visitation policies changed recently? Can people come and see the baby in the hospital?
Yeah, I can take this one. So again, each hospital will have a little different visitation policies. It sounds like at Landmark currently there are 2 visitors allowed postpartum, and at Care New England, so that's Kent and Women and Infants, it's 1 partner and 1 doula. And so, having you identify your people, and those are the people who can be with you for your delivery, but also to visit you and your baby in the hospital. I will say again that if you are known to be positive for the coronavirus, that won't be possible, simply because we want to keep your family members safe too. And then in this time, we also, even when you go home, we are trying to counsel people not to have a lot of visitors around them or the baby. We're still in a time where we're recommending physical distancing and connecting with family in other ways, like this video conference or FaceTime, so that everyone can meet your baby, but there isn't that risk of infecting a mom or a baby or each other, until we know a little bit more about when it will be safe.
I think you bring up a really great point as well, is that even outside of the pandemic, we always really strongly encourage new families to strongly consider who's coming over to hold and interact with your newborn baby, because let's remember that newborn babies don't have as strong of an immune system as we do as adults, and they don't have vaccines yet, and we want to protect them. And so something that might cause a very mild cough or cold in an adult could get a newborn baby really sick. And so thinking about those same prevention strategies that you would have outside of the coronavirus, it's basically the same now in the setting of who's coming to interact with your newborn. Are you letting them hold them? What infection precautions are you taking, versus maybe you make the decision that it's just going to be your immediate family for now. And any of those decisions are okay, and I think it's very much a decision that you make for what's going to be best for you and your family.
So we have another question from Elaine from Tri-County WIC. Are you recommending breastfeeding as the better choice to protect and increase infants' immune system?
Yeah, I would say we always recommend breastfeeding. This guidance really hasn't changed because of COVID. There are some real health benefits for moms and babies that we know about with breastfeeding. And as I had mentioned earlier, even if a mom is COVID positive, if it is her wish to breastfeed, we can help support her to do that as safely as possible with the baby. we also recognize that for some families that is not a choice that fits, or that's not something that's possible. And so if that's the case, certainly both in the hospital and at home, we have other ways using formula to feed your baby. But if a mom really wants to breastfeed and knows about the benefits to her own health and to the baby's health, that is absolutely something we're all in strong support of.
Totally agree.
Thank you for answering that. I'm just seeing if there's any more live comments coming in or any questions.
I see one question in our private chat. Do you see that one, Marianne?
Let me see. Okay, so we do have another question. And it says, should I still work while pregnant during this crisis?
Sure, I'm happy to take this one. So I think that's a really hard question. I think, again, it really is such a personal decision when it comes to what your personal risk might be at work, and how much that impacts you and affects you, both physically but and emotionally, and what your, what sort of availability you have to either work remotely, potentially from your home, which is always a great option if you have that, versus speaking with your manager in regards to taking a leave and how that impacts you financially. I think these are all really important things to think about. You definitely can go to your OB provider to have a more in-depth conversation about it, especially if you have some things going on with your pregnancy that might put you at slightly higher risk. And so I think thinking about all of those things and then talking to your OB provider is a really great idea.
Thank you for answering that. I don't think there's any more questions. Let me just make sure.
I can talk a little bit on how our doula works while we wait for other questions.
Okay.
So how our doula works, so they actually come to your house. They actually help you get ready for the birth. They teach you what to expect during your pregnancy, during labor. If you need help breastfeeding, they're there for you. They get you ready for your prenatal visits. They teach you how to care for your newborn. Some hospitals are also letting doulas be in the delivery room. And also, if any of our Tufts members have any questions, any concerns, they can call member services. We also have case managers that can work with you guys. So if you have any questions, just give us a call.
That is awesome, Wendy. Thank you. We have another question from Elaine. She said, so basically, if a mom is positive for COVID-19, then she will need to wear a mask around her baby until she has a negative COVID test?
Yeah, that is the current recommendation. Again, we know that wearing a mask significantly cuts down the transmission of the virus from people who have tested positive to others. And, breastfeeding, holding your baby close to your face, that is pretty close contact. And so wearing a mask really reduces the chance that your baby is going to be exposed or sick from the COVID virus. The amount of time that people are testing positive, for most people, they start to test negative 10 to 14 days into their illness. There are cases of people who are positive longer, but that is generally the amount of time that we're talking about. And again, working with your baby's healthcare provider and your OB about figuring out when the right time to get retested and the right time to kind of back off on those infection control precautions will help you get the best plan in place for you based on what your results showed.
And it brings up a really good point, which is that we shouldn't be masking any kiddos who are less than 2. So newborn babies should not have masks. Because and that reason is because if you're less than 2, it could potentially get in the way of your airway and potentially cause that kiddo to stop breathing. So just remember that. So newborn babies don't get masks.
Thank you. These next 2 questions are going to be directed towards Wendy. So Elaine said, could I get a list of names of doulas?
Sure. If you actually call our member services, they can connect you to doulas in our area. And if you have any questions, I can give you my email, or somebody from Thundermist can give you my email and I can get you a list. And then there's another one. Some insurance doesn't cover doulas. As of right now, Tufts Health Plan is the only Medicaid carrier that offers a doula program for our members.
Thank you, Wendy. We have another question. It said from Rodia LeBron. Will we need to wear a mask while in labor?
I can speak for Kent Hospital in that we are, so whenever there is a patient in labor and their support person, when you're in the room by yourself without any support staff, you don't actually have to have your mask on if you prefer not to have it on. But as soon as someone else walks into the room, whether it is the nurse or the provider or someone from the lab or anyone else coming into the room, all masks have to be on again. And then during pushing, we expect the support person to maintain their mask on. We do not expect moms to push with the mask on, which is why as your delivering team, we put all that gear on, because we recognize that you're working really hard to have a baby right now. And so we're gonna protect ourselves instead. So that's that, Ken.
Yeah, and I would say that it's similar at Landmark. No one is pushing or in the end part of their labor with a mask on. If you have had your rapid test and it's negative, then you do not necessarily need to be wearing the mask, but all of your healthcare team will be. And certainly you are allowed to wear the mask, as you would be in any kind of public place that you'd be outside of the hospital. If you do test positive for COVID, we will ask you to wear the mask during the non-pushing interactions with your healthcare providers.
Thank you. So this next question is for Dr. Buckley. If you could clarify, it's from Amanda Bonney. I have seen some confusion about masks versus face coverings for children under 2 years old. Could Dr. Buckley clarify if there are any face coverings safe for young children?
My full clarification is, my understanding is that we're not supposed to be doing anything for kids under 2. I don't know if, and that's based on the most recent guideline that I read from the CDC. I will ask Dr. Johnson if she has another understanding of that or something that she could educate me on.
No, I agree with you. I was reading some updates on this actually within the last week. I know that some people have like face shields, and so that's something that actually goes around your forehead, and it's like a plastic shield in front of your face. And from the current recommendations, those are not recommended either. They are less risky to the airways than the cloth face masks. But they haven't been shown to actually help. There's still a lot of air circulation around them. And so kids under 2 actually, there's nothing that's recommended right now by the CDC in the covering realm. Really the best thing for those kids under 2 is to really limit their exposure to public places as much as possible, hand washing, and then all the adults around them and older kids wearing masks.
I just want to let everybody know, Wendy from Tufts, you can email her. Her email link is in the live comment section. And I want to thank everybody for their questions. They were good questions. So it looks like that's all we have for questions. Well, thank you, everyone. We hope you have enjoyed getting to know our providers, our sponsors, and that we were able to answer all your questions. Before we leave today's session, be sure to enter to win our grand prize raffles. Participants can look in the comment for the link to enter to win or visit the link in the comment section. Today's session will be recorded and available to view in the future. Thank you to Neighborhood Health Plan of Rhode Island, United Healthcare Community Plan of Rhode Island, Tufts Health Plan, and Landmark Medical Center for generously sponsoring this virtual series. If you have any if you need any prenatal or primary care, Thundermist offers this services for all ages and does not turn anyone away due to ability to pay. Call us at 401-767-4100 to schedule an appointment today. Well, that looks like that's a wrap, and everybody have a blessed day.
Thank you. You as well.
Bye.